While men often joke about penile length, it belies a significant insecurity that many men have. There's tons of material out there where jokes about penile length are made and what is a normal length. This clip from Scrubs is one of my favorites.
Mr. Peters, I know that having a gal urologist might seem a little uncomfortable, but the penis is just another excretory organ, so let's go ahead and take the stigma off it. Now, this is the length of the average penis.
What?
That seems about right.
Good for you. I was just messing with Dr. Dorian over there.
The use of mechanical forces to move and rearrange tissues is not a new concept. We see this application in both orthopedic surgery, but orthodontics as well. So the fact that we can place braces on teeth and move them shows that tissues can be moved within the body. Now the question is, can the penile tissues be moved and stretched to increase length? And that's a topic that we're going to explore a bit today. So really there are two ways that one could attempt to stretch the penile tissues using mechanical devices. The first would be what's called a vacuum erection device. This is a quote-unquote penis pump, and this is a device that is placed external on the penis and a suction is created. This suction is created either through battery operated power or through just a pumping mechanism on the device. This pulls blood into the penis in an attempt to create an erection. When used for erectile dysfunction, you usually have to place a constriction band at the base of the penis to keep the blood in. But since it is stretching and pulling on the penis, it has been used in attempts to stretch the penis and create longer length. Now, that's one option. The other is there have been traction devices which have been created. These have primarily been created for the process of Peyronie's disease, which is a disease process which results in the buildup of scar tissue and can shorten the penis. I've made separate videos there. These devices, through a variety of different mechanisms, are placed on the penis and pull on it in an attempt to stretch it. There are a number of models which have been historically used, one called the Andropenis, the Penamaster Pro. There's a newer device which was created at the Mayo Clinic called the restroreX, which has been used for the treatment of Peyronie's disease, but in theory could be applied in this situation as well. So the studies we're going to focus on first are for men without any particular disease process or recent surgery, just men who are dissatisfied with the length of their penis and want to have augmentation through non-invasive means. So let's look. There's only been one study which really looked at men who just wanted a longer penis and used a vacuum erection device. This was actually a prospective study which took men and had them apply the vacuum erection device 3 times weekly for a 6-month period of time. The increase in penile length was 0.3 centimeters with 6 months of use. So this was not statistically significant, which is in scientific studies how we determine if this was a meaningful intervention or not. But interestingly, 30% of patients reported satisfaction with the outcome. This may be simply a psychological or some type of placebo effect, but definitely not a meaningful increase in penile length with this method. Now, with respect to penile traction devices, which may be more effective, there have been a couple of studies, not many, but a couple of studies looking at this. One recent study from the Journal of Sexual Medicine really summarizes what the results show, however. In this study, the Andropenis was used, which is a type of traction device. It was applied daily for 6 hours. 6 hours for 6 months of time. The increase in the penile length when erect was 1.3 centimeters. So we're talking half an inch for daily use of a device for 6 hours a day. Don't want to editorialize too much, but that seems like a lot of work for 1.3 centimeters in this humble opinion. Okay, so bottom line, for men who just want to increase their penile length, vacuum erection devices probably don't get you really anything. The penile traction devices will get you some increase in length, but pretty modest based on the data that we have. We have to talk about it, jelqing. So jelqing is this idea that you can massage the penis in a somewhat traumatic fashion with the idea that you create tears in the penis which will increase the size. The analogy that was kind of brought forth is, okay, when you go to the gym, you stretch a muscle, you tear it, that will increase the size. The penis is not a muscle. While there is smooth muscle within the penis that relaxes to allow blood flow to come in, the idea that you can stretch and tear your penis and make it longer simply just doesn't align with how the penis works and the way its anatomy works. So we have mainly focused on men who have no particular disease process and have not had any particular surgery, who want to have increases in penile length. This isn't really the purpose of the video, but I do want to emphasize there are subsets of men who probably do get more benefit from the idea of penile traction. Two groups in particular come up. Men with Peyronie's disease, which is a shortening process of the penis, which is caused by the buildup of scar tissue, particularly when using the restroreX device, which can be worn for shorter periods of time. There are studies that show that it increases penile length. Gains are modest, a couple of centimeters or essentially an inch or so, but nonetheless definitely statistically significant and can be meaningful to some men. The other group is people who have undergone a radical prostatectomy for prostate cancer. We definitely know that there are probably a number of pathways which lead to shortening of the penis in this group. And a study has shown with men who wear the restroreX device post-operatively, they actually have improvements in their penile length. So what's the punchline? Men who have no particular disease process but just want a longer penis, can they stretch their penis? Maybe a little bit, but not a whole lot, and it's a lot of work to get there. Men who have Peyronie's and who have undergone a radical prostatectomy, it's probably more reasonable for them to use traction devices to preserve or prevent penile shortening. Please like and subscribe if you found this content meaningful.